It's actually crazy. The United States doesn't have universal health care. Brought to you by Whole Washington Pre-Universal Healthcare in Washington State. So first, the countries that the United States shares not having free or universal healthcare with are mostly in sub-Saharan Africa, the Middle East, and Central Asia. These are not the kind of peers the United States generally sees itself with. This is a shock tweet. The average out-of-pocket medical spending for a day in the hospital in the United States is over $1,000. It's actually higher than this now, whereas in most other comparable countries, it is free or a very small charge. In the United States, a majority of people either have government insurance, which is the dark blue, the compulsory health insurance coverage, Medicare and Medicaid, or voluntary health insurance. This is private insurance through the employer. However, you can see the United States has this 9% uninsured category, and this is just frankly too high. Despite insuring fewer people, the United States actually spends significantly more per capita than its average comparable nation. In US dollars, it's about double. The United States actually has enough specialists per capita compared to other nations. However, we have far too few general practitioners as compared to every other comparable country. In addition, we have a distinct lack of mental health professionals, and both general practitioners and mental health experience extremely long wait times compared to every comparable country. The maternal mortality rate in the United States is significantly higher. The amount of patients who skipped care in the United States is significantly higher due to cost. The next highest country is actually Switzerland, and they have the same problem where they have compulsory private insurance, and it is too expensive. If normal inflation were taken into account from 1999 for average annual premiums, single people would pay only $4,180 per year for health insurance. However, that's not the way things went. Instead, $8,951 are required per year for the average single insurance premium for coverage, and this is more than double the inflation rate. If we look at premium increases over time, we can see that for every period except the most recent period, premium increases have outpaced both overall inflation and workers' earnings over those same periods. The average deductible amount has also gone up, starting at about $600 in 2006, all the way up to near $2,000 now in 2024, a 3 times increase. The percentage of people who are uninsured is highest amongst the 18 to 64 demographic, so adults. And this is because the 65 and older demographic has Medicare, and the 0 to 17 demographic often gets covered by Medicaid. There is no crutch program for most adults, and many people find themselves without health insurance during those times. The communities that are hit hardest by this are our Hispanic and Black communities. White and Asian communities tend to have very low rates of being uninsured, whereas especially Hispanic communities have almost a quarter rate of adults. A quarter of adults do not have health insurance. And what does this lead to? This leads to a diminished lifespan in the United States. If we have universal health care, we can get closer to our comparable countries. Want to help universal healthcare succeed in Washington? Check us out at wholewashington.org.